Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban, and yes, you are right. It is Q&A. It's question and answer episode. Many of you love this episode because you guys actually are getting better and better at this. You guys are asking better and better questions, so kudos to you. Anyway, I'm joined with my extraordinary producer, Maria, whose birthday it was recently. Happy birthday.
Thank you.
Right, turning 21 all over again. Let's not waste time. Let's dive in and let's start going. These are all questions that you guys have asked through one way or another, whether it's through Instagram or other social media platforms. Maria, you want to make sure you give these individuals the credit they deserve. So give them a shout out and read me their handles or whatever their tags are.
Okay. Well, I want to first ask you a question because this come up several times. People have come to me and they've asked me to ask you, what are your thoughts about Ozempic and do you do it?
So Ozempic is the new miracle drug. If you think about it, every so often there's a new miracle drug. Botox was a miracle drug. And by that, I mean it's a drug that we stumble across. It's something that we find out accidentally. And Ozempic and a few others, I think Wegovy and some others are hormone. Actually, to be truthful, I don't even know what the hell they do. They were originally intended for diabetes or diabetic individuals, and they somehow modulate hormones and insulin. All I know is that the side effect, and I don't mean side effect, but the side outcome or what is the word I'm looking for? As a result of taking the medication, you lose weight, and I mean a decent amount of weight, and it has now become the weight loss wonder drug. This category of medications of the country. So much so that there is a shortage and people are selling this Wegovy and Ozempic for 10 times its normal value. It's become like a drug, a true drug on the streets. And it's in every OBGYN's office. They're giving it to their patients and women, mostly women, but also men. People are losing weight by the pounds. I don't have a comment because I don't know, and nobody does. What are the long-term effects of this drug? In general, the basic principle is very simple. To lose weight is easy. To keep weight off is difficult. And so my wife and I were having this chat actually last night, and the fact of the matter is that it doesn't really matter what drug you take or what method or what trickery you do to lose the weight. The question is, can whatever you do be sustainable? And my concern, it's not really a concern, but my wonder is, hey, okay, I took this Ozempic. I don't think you can take this long term. I think there's a period of time you can take it for. And then what happens? Do you still crave the French fries and the pasta? Are you still drinking wine? Are you still eating late? Are you still having a bunch of sweets? Are you still not getting off the sofa? So the truth of the matter is the drug works incredibly well. Millions of people are on it for weight loss and not diabetes. And the big question is what will happen once you are off the medication? TBD, to be determined.
Yeah. Okay, so let's start with Hippie Mama 6.
Hippie Mama 6, here we go.
Do you take out silicone from micro droplets in lips from the 80s? I've never heard of micro droplets.
Yeah, so the question is, do I take out micro droplets of silicone from the lips from the 80s? So this is several parts. It wasn't just the 80s. It was done in the 90s and early 2000s and kind of still being done, which is basically lip augmentation using liquid silicone. And the answer is no. No one can take out liquid silicone from anybody in any body part, whether it was used for the cheeks, the lips, the butt, the breast. And as a result, back in the day, people didn't really understand the ramifications of injecting this permanent product into your body. And now we know pretty damn well. So the problem with liquid silicone, as opposed to silicone implants, breasts, chins, etc., is that it's free floating and it gets integrated, and it's imagine millions of little breast implants, and it gets disseminated throughout your tissue, in this instance your lips. And then what we found out is at the beginning, wow, this looks great, and then your body goes, what the hell is this and this and this and this and this, meaning millions of little droplets, and your body tries to get those millions of droplets out, which in breast implants It does, but it's only one droplet, one big ass droplet, and it makes a shell around it or a capsule. And in lips, you have millions of little capsules and inflammatory areas, and you get these continuous changing of your lips. And so one of the procedures that I now do a lot of is lip reductions, which is a alternative way of trying to address messed up lips that have continued to change and evolve and grow and get lumpy and bumpy from lip injections. So the answer is no. No one can remove liquid silicone from any body part. And as a result, you shouldn't be injecting anything permanent into your body ever.
Good advice.
All right.
From Cal to France, can you
Cal to France.
Cal to France. Can you comment on the advances on avoiding vertical scars on breast lifts?
So this is an interesting question. So Cal to France, the question is, how do I avoid the up and down scar on a breast lift? So let's back up here. What is a breast lift? A breast lift is, hi, Dr. Rahban, I don't like the shape of my breast. They're sagging. The nipples are pointing down. I've had a few kids. I've lost a lot of weight. I've breastfed, what have you. And now I want my breast to be full and lifted and perky. So the need for any scar is that we have redundancy or excess skin. And that excess skin, like a seamstress or a tailor, needs to be excised and removed to create a new shape. So if you came in with a jacket to your tailor and you said, listen, I lost 25 pounds. Can you do me a favor and make this jacket fit me? They're going to open up a bunch of seams and remove material. The seams are the outer seam, the inner seam, etc. So the incisions around the nipple, the up and down, and the one in the fold, those seams are necessary to remove the extra breast skin that you have. Otherwise, you can't lift a breast that has extra skin. So which seam is needed depends on how much extra skin you have. When you have a little bit of skin, you can get away with a donut. When you have moderate skin, you need a donut and a vertical being up and down. When you have a lot of skin, you need around the nipple, down the breast, and in the fold. The answer is there's no advancement in science that's going to override geometry. And geometry is, I got all this loose skin. The only thing that's going to ever change that is if somehow magically, and I use the word magically, we find a method that's going to shrink up all this skin, which we have yet to ever find. So I don't foresee that unless we change the world of geometry, that you're ever going to be able to avoid the up and down if that's what you need, aka you have that much skin.
Now, can I ask you a question? If someone does a breast reduction where they have the anchor scar and they gain weight, like when I gain weight, I gain in my breast, and they gain weight, will that scar open up? Will it stretch?
No. Once it's healed, it's healed. And of course, when you gain weight, and wherever you have incisions will expand, meaning the tissue underneath it. But the scar doesn't widen or anything like that. You know, you had an appendectomy when you were a little kid. Now you're a grown adult. You're 50 pounds heavier than you were when you were 12 years old. And your scar, if it was shitty then, is shitty now. And if it was great then, it's even better now.
So it's basically the skin that expands, but not necessarily the scar is going to...
Yeah, the scar doesn't get...
proportion.
No. The scar won't get significantly different.
Oh, okay. So our next question is, from S.Leslie_renal.
Leslie_renal. Okay.
Hi, how do you limit muscle loss when recovery from surgery? Example, tummy tuck.
Okay, so the question is, how do you limit muscle loss? I assume you mean atrophy after surgery, like a tummy tuck. And the answer is, it's really not that difficult. I mean, every surgery I do, and I mean everyone, body lift, thigh lift, brachioplasty, facelift, every surgery I do has essentially the same recovery. We want you to limit your activity, exercise, for 6 weeks. We want you to take it easy. Your body is healing, your tissue is healing, your incisions, your scars are healing. At 6 weeks, irrespective of whatever surgery I had done for you, 40 surgeries, 1 surgery, I'm going to tell you to resume all activity. So you're not going to melt away and atrophy and require physical therapy after 6 weeks of taking it easy. So tummy tucks, at 6 weeks, I tell you to go. And when I say go, I mean go hire a trainer and start exercising. And so you should be able to bounce back from a tummy tuck without any issue whatsoever. The only time atrophy occurs is you get a complication. You read these people online, or I see patients. They go and get a surgery. The surgery goes terribly awry. You end up not being able to be active for months at a time. And then you will start to notice some weakness or atrophy. But that takes a significant blow to the system. A normal, ordinary 6-week period of time is not going to make any difference whatsoever.
Okay, so thoughts on a facelift at late 30s and 40s?
Who's asking it?
Melissa S. Johnson.
Melissa S. Johnson. What are my thoughts on basically early facelifts? Now, 30s and 40s is interesting. So I had this conversation literally last week. So facelifts have had a sort of a stigmata associated with them. My nieces had their noses in their teens. Nobody ever blinked an eyelash. Breast augmentation, early 20s. Mommy makeovers in your late 30s, even early 20s, depending on when you've had kids. Facelift, oh no, facelifts are for people that are 60 or 70. And that used to be the case. So then we had to come up with all these kind of Mickey Mouse words like mini facelifts and neck lifts, et cetera, to get people to really understand that the surgery is not connected to an age, but rather connected to a condition. If you, for example, lost a ton of weight or genetically were predisposed to loose, saggy skin, whatever the age is, you have it. I mean, if you show up in my office and you have had a tremendous amount of liposuction under your neck, well, you're going to develop loose skin much earlier than you would otherwise. So the answer to your question is there is no exact date, such that now, even in the last 2 months, I've done 4 facelifts in 50-year-olds. Now, early 50s, I'm talking 48, 49, 50, 51. That was the old 65, 70. So we have definitely moved towards doing these procedures a bit earlier, meaning as the neck skin starts to occur, the jowling occurs, the jawline starts to look kind of a little less crisp. But that being said, when you're in your 30s and 40s, assuming you have normal skin tone and you're tight, and you're a little hollow, the answer is not a facelift. It's a long run for a short slide. So on the one end, you should not be afraid of doing it when you start needing it in your late 40s, early 50s. On the same token, if you're in 30s and you want a different look to your face, you don't run out and get a facelift. That's a big hammer. So I don't know if that answered the question, but my point being is that you can start sooner when you start having the signs, but it's not like some preventative procedure. You're not going to come in at like 37, have a perfectly crisp face, and just be like, I want a facelift. I think it's overkill.
But can I ask you, someone that's young, that was obese and has lost massive amount of weight quickly, let's say that they have a bariatric operation, whatever, and let's say that would their neck be sagging, whatever, they could use it?
Of course. No, listen, the answer is, I never ask you your name. If you walk in the door and I look at your face and you got literally skin hanging from your neck and I say, how old are you? And you're like, I'm 19. The answer is, we need to remove it. Like if you're insecure by the neck skin that's hanging and you happen to be 19, it's very unlikely. But my point being is the answer is you fix it. You wouldn't hesitate to fix someone's nose when they're 19. So the answer is you do it when the body has the need for it, whereas before it was kind of age-related.
By the way, we got this, it was not a question, but this Tansy Mid-Dag, TANSYMIDDAG, Tansy Mid-Dag, whatever. No question, just a thank you for putting out honest information.
I love that. Thank you so much. We love any kind of positivity. That's very sweet.
Okay, so from Min Hulu, how long does it take to recover from liposuction on average?
So the reason why we threw this question is because it just applies to everything. So whether it's liposuction, tummy tuck, body lift, rhinoplasty, all procedures, at least for me in my practice, and remember, this is sort of recipe-based. This is each chef has their own recipe. For me, all my patients go through the same recovery because it's not about the area, but rather the body's healing potential. 1 to 2 weeks, you got to take it significantly easier. So first 1 to 2 weeks, depending on the procedure, you're going to kick it at home. You're not going to go to work. You're not going to be doing whatever, depending on the procedure. And then from, let's say, the 2-week to the 6-week mark, you can go live your life minus any significant exercise or strenuous activity. At 6 weeks, I always tell everyone, go for it. And that is the same healing for liposuction as it is for tummy tuck. Sure, you're not healed at 6 weeks from any procedure, but you're healed enough that you can start to really resume your life. And then the healing process can take anywhere from 6 months to 18 months, given the procedure that you had done. That applies to every single procedure.
Okay, so next question, something that's very in right now, which are transgender operations like facial feminization surgery. Suzuno is asking, do you do transgender operations like FFS, facial feminization surgery?
So
that's a trending topic.
Yeah, well, I mean, listen, there's always going to be things that become more common and popular. It was, whether it was breast dogs in the 90s, then it was BBLs, then it was facial feminization surgery is much more popular. So the answer is yes and no. I don't do it as a collective. I do think that there is a sort of a subspecialization associated with transgender surgeries, meaning I think that there is something to be said when you do a lot of them and you specialize in that area. There's more than just the surgery itself, but the sort of emotional, physiologic elements to it. I think that people who do facial feminization do best by going to people who do a lot of it. So the answer is I don't do a lot of it. It's not something that's common in my practice. And I think, if I were out there wanting to get facial feminization, I would search and seek for individuals who do a tremendous amount of it, because I do think it has its own area of subspecialization. So can I take a large nose and make it look feminine? Sure. Can I, you understand what I mean? I can feminize a part, but as a collective whole, what you're looking at when you are doing this transgender journey, obviously everything has to match. So for example, we had an episode with Barry Eppley, who does a tremendous amount of transgender surgery, where he does like shoulder shortening or lengthening and Adam's apple shaving and all those other elements that go along with with transgender surgery. I don't do any of those. And so I think that's where someone belongs in a practice like that.
Okay, so next one is from...
Are we supposed to take a break at some point? Are we getting in trouble here?
No, you're fine. One more question before we go to break.
All right.
How long after giving birth can I do a tummy tuck? That's from Lynn Mizrahi.
Lynn Mizrahi. Okay. That's a question that I hit all the time. I do a lot of C-section closures for individuals who want a plastic surgeon present, and everyone, 99.9% of them ask me, hey, while you're there, can you take a little skin? And the answer is no. We can't take a little bit of skin because, as you are well aware, we have no idea how much of your skin is going to snap back after you give birth. I mean, you give birth, there are individuals who give birth, they look like they have a basketball that just comes out of them. They got a tremendous amount of loose skin. One woman snaps back and has got a washboard abdomen. Another woman doesn't snap back and has got loose skin. How do we know who's going to be whom and what's going to happen? So the answer is you don't do anything, in my opinion, aesthetic and or refined in the middle of the wake of a delivery. It's chaos. What you want to do is you want to get back to your ideal goal or relatively stable weight. I use all those words because they're all different for people. Goal weight may never occur. Ideal weight may be ridiculous and different for everyone else. Pre-baby weight, you may never get back to since now you have had your 4th or 5th kid. What you want to do is, this is the key, so pay attention. You want to pick a weight that you think realistically, A, I can get there. B, I can stay there. And that's the weight you want to be at when you do your tummy tuck after you had a baby. Because after a few months, your uterus is contracted, your muscles are better, and you're good to go. Some women, after a few months, they're lucky. Their metabolism kicks in, and they are relatively where they were before baby, some even under. For many, a few months after having had a baby, they're still 10, 15 pounds from where they were and it takes them a solid year to get that weight off. What you don't want to do is be like, F this shit. I don't want to wait anymore. Let me just go and get this thing taken care of. That's just a bad idea. You want to get to where you can reasonably stay. The reason I say that is because on the one end, if you're like, I'm 160, my goal is 140, okay? And you never get to 140, and I see you 6 years later and you've been miserable, well, then just 6 years of your life pass. On the flip side, if you do it early, then you lose the weight, then you'll be loose. Your result will be ruined. If I operate you at 160, assuming you're a candidate, and then all of a sudden all your baby fat comes off and and you get in triathlete mode and you start being a vegetarian and all of a sudden you're 137, yeah, your result's going to not be as good because you're not as tight as you were when we operated on you. So try to pick a stable weight. That's my number one pet peeve, fluctuations in weight. I don't care what you weigh, just stay there.
But can I ask you something? So you're saying pick a weight that you're not going to fluctuate. But let's say that you do it in your 30s or late 30s. But then when you hit menopause, all of a sudden...
But I'm not talking about that, Maria. I'm talking about
You're not talking about that, but what happens...
Nothing. Your life changes. You did your surgery.
You can do a tummy tuck a second time around. It's not an issue.
No, it's not that. I'm not talking about life. I'm talking about short term. I'm talking about you do your surgery and then 8 months later you lost a shit ton of weight. Mm-hmm. Don't do that. We're talking about try to pick a weight that you can sustain. Now, obviously, I don't weigh what I weighed in high school. Right. And so every 5 years or decade, you're going to change weight. That's acceptable. That's life. But you definitely know when you're not where you need to be and you're just frustrated and you're just throwing in the towel. I'm saying you're doing yourself a disservice. That's all.
Okay. We're going to go to break. And when we come back, we're going to have more questions.
Good ones. You guys are asking good questions. I'm proud of you. We'll see you back after the break.
On Plastic Surgery Uncensored.
All right. We're back to the second half of Q&As. Maria, what you got for me?
Okay. There was a question from Laura Osment.
Laura Osment. What's the question?
It's regarding recovery centers, which I wasn't familiar with. When do you recommend an aftercare after plastic surgery, a recovery center?
Okay, so this is a subject that is not uncommonly asked, is aftercare or recovery. So here it goes. So there are different reasons to do aftercare after a surgery. One is because I want to, and one is because I need to. The 1-2 is it's a luxury. You have to pay extra money. So it is a luxury to go to a facility where someone else will take care of you for a day or 2 or 3 or 4, whatever that is. That is in lieu of somebody else taking care of you. Who's that someone else? My husband, my wife, my kids, my mother, whoever. Someone has to take care of you. You had surgery. You can't take care of yourself, at least not at the very, very beginning. So for some people, the aftercare is a luxury. I don't want to go home. I got 4 kids. My husband gets squeamish. I don't want to deal with these people. So I want 24 hours of peace where I can have somebody else comb my hair, give me some applesauce, and take care of my drain. Fair. No problem. It's a luxury. You pay for it. The other is you have to go. You have to go. Why? Because your surgeon feels it's necessary because they want you to be monitored, and it's usually for 24 hours after the case. So what are the things that make you indicated? For some people, it's pain management. I don't ever send people for pain management. You should be able to manage your pain at home no different than an aftercare. One is that you've been under anesthetic for a very long time. So let's say for me, my cutoff is 6 hours. So I do cases that are 8 hours, 9 hours, full facial rejuvenation, total body remake, body lift, etc. After 6 hours, I feel like, you've been under anesthesia for a very long time. And while it's absolutely safe, I feel more comfortable if the patient is in an observed environment for 24 hours. So that's one criteria that I use. The other is where I want something very closely monitored. So when I do a facelift, I always send people to aftercare because when and if, albeit super unlikely, you develop a bleed, usually your family members are not going to pick that up at home. So I send you to an aftercare. I don't really send people to aftercare that often. I find people do quite well at home, assuming they have a loved one that's responsible and mature that can take care of them. So every surgeon will have their own criteria. The caveat to all that is that the majority of aftercare suck ass. Why? Because they're money-making machines. And what happens is you think that you're going to spend all this money and go to this facility and you're going to get this top-notch nurse who's going to hover over you. And it just doesn't happen that way. What happens, you go to some facility, they're usually not nurses. They're like nurses' assistants. They're usually like one nurse or nurse assistant to every 4 or 5 patients. And I don't know that the quality of these places is outstanding, at least in Beverly Hills, which you'd think would be like the shit. It's shit. There aren't very good aftercares. And so the next thing that I've done is we start sending some patients home with one-on-one nursing. So you go to your own house, but you have a nurse there, which I think ends up being probably the best option. If I could, I would have my own aftercare, then they'd be under my scrutiny and it'd be my nurses and it'd be my protocols. But as of now, I got too much on my plate.
Okay, so what we have from Mel_Lowy.
Mel_Lowy. Okay, what's the question?
What happens if you gain weight after a mommy makeover?
What happens if you gain weight after a mommy makeover? It's a shame. That's what happens after you gain weight over a mommy makeover. Listen, it's not the end of the world. Your body isn't going to explode. The incisions aren't going to rupture. In some instances...
Starting over, right?
What?
You're starting over.
Well, I mean, listen, no, not really, because they're too... Listen, people have this understanding that mommy makeovers or surgeries is to get rid of fat. I never, ever change your overall weight. I change your shape. So if you got huge, saggy breasts, and I do a breast lift or reduction, and then you gain 20 pounds, you're going to have bigger, pretty breasts. You're not going to have the saggy breast that you had because I've removed all that skin, and that skin came as a result of years of life. Mm-hmm. When you come to me and you've got this huge belly that's hanging and muscles separated, and I do your tummy tuck, and then you go and gain 10 pounds, you're never going to look the way you did before I did your surgery because you had a hanging skin and loose muscles, and I fixed all that. You're just going to be a bigger version of what I did when I did it. So it's not like all is lost and everything goes to shit, but it goes from an A+ to like a B+. It's definitely still better than where you were, but I'm a perfectionist. I think it's a waste. Why? Because you're going to save all this money and go through all this trouble and kill yourself so you can look your very best. And then because you just couldn't control how you eat, that's all it is. It's not the exercise. It's not the stress in life. It's just I can't control what I eat. You're going to ruin such a lovely piece of art, aka yourself. So the answer is you're not going to destroy everything. You're not going to get saggy breasts with separated muscles and hanging skin, but it's just not as good as it was. So that's all.
Now we got from Yana_Mar88.
Yana_Mar88. What's the question?
Do you like to do lipo on the waist with the tummy tuck?
So do I like to do liposuction of the flanks with a tummy tuck? And the answer is essentially almost never. So anyone who listens to the show, anyone that follows me, knows that I am very anti-liposuction. For a very brief second, I will tell you again why. When you liposuction someone, I don't care who's surgeon, what the surgeon is, what technique they use, what cannula they use, where they do it, you're doing the same shit every time. You poke a hole, you suck out fat, you create a bunch of irregularities, and then you pray to God that the skin that the skin from the area you removed it becomes tight and snatched, which it never does. So the technology is flawed. That being said, certain areas do better than others, and the flanks or the love handles do all right. Why? Because the skin is tight and it's curved, and there's a whole bunch of reasons. Having said that, when you go see your average surgeon and you say, I want a tummy tuck, the answer is tummy tuck, liposuction, love handles. It's like a 1-2 combo. They're not separatable. They're just, that's the procedure. And the answer is, you want a waist, don't you? Of course I want a waist. I want a really cute waist. Well, I have to liposuction your waist. And so that is how this exists. I don't believe that because of the following reasons. Number one, you can't liposuction a waist. Your waist is determined by the relationship of your ribs to your hips. When you have narrow ribs and wide hips, you're curvy. When your ribs and your hips are in the same plane and you have a short torso, you're not curvy. The end. Where liposuction comes in is if you're overweight and you have a ton of fat that's sticking out, then I can sculpt that fat away and create the illusion that you have a waist. But those are not the people I'm operating on. I'm not operating on you when you're a huge block of extra fat. Where I get my waist, you go to my work on my gallery, and you look at my results, you're like, holy shit, these people look like they have waist. How did you do that without liposuction? What I did is I tightened up your muscles. So you're going to a party tomorrow, Maria, and you want to look awesome in that Hervé Leger dress that looks so pretty. Are you going to put tape on your hips as if you liposuction it, or are you going to wear a corset and snatch your belly right down the middle and pull it inwards? So when I do my tummy tucks, I am pretty aggressive about muscle repair. And when you pull the muscles inwards, you are maximizing your pre-existing shape. In other words, when you were 20, pre-baby, you have a certain curvature to you, and your babies or life ruined it. I'm not going to make you any more curvy than you were. That's me. Now, there are other surgeons and other techniques. I don't like the way those look, weird shelves in your hips and dents and divots and then fat in your butt. That's a whole different animal. That's not my preference, my taste. But in my hands, I only do liposuction of the love handles in conjunction with tummy tucks when there's something to liposuction, not in order to create a fake weird-looking waist.
Now, from International Realtor.
International Realtor, that's like International Man of Mystery, yes?
Yes. Why, I'm not sure if I understand this question, why don't they wear the same underwear on before and after pictures? We need to see stitches.
Okay, that's a great question. I don't know if this was the question, but I'll make a question out of the question. Is when you go to people's galleries and you're looking at tummy tucks, which is an area of expertise of mine, and I'm a real stickler, the before photo, they're wearing this really skimpy ass underwear underneath their panties, in their pubis, showing their whole gut and everything's hanging out. Check. The after photo, they're wearing thicker underwear. It's halfway up their abdomen. It's like 1 inch or 1.5 inches from their belly button, and it's like their torso is in half. What the fuck? What happened? What happened is the scar is halfway up your abdomen, and in the after photo, you have to cover it with the underwear. Nobody would wear their underwear that high unless you're covering something. You're covering a pooch, you're covering a scar. Go to my gallery. Look at every single photo. The underwear is in the groin. So the goal in an abdominal shape is a long torso. If you're 5 foot tall or you're 5'11", you want a long looking torso. That means you want a lot of space under your belly button. That means that you want to wear your underwear in your groin where it ought to be. And when you look at it, you have space above your belly button and space below your belly button. So the reason the after photos look the way they do is because you're hiding the scar that's migrated and risen over time. Now, your next question is, each surgeon should have a section where they're showing their scars. You're referring to, why can't I ever see the scars? It's because no one wants to show you scars because scars are not very inviting. Doesn't make you want to run out and do the procedure. So for our instance, we have our before and afters, and then we have a section called tummy tuck scars. And you can go and see what they look like. You like them, you don't like them, etc. But usually the trade-off for what we do is usually well worth it. So that answers your question.
Okay, I have a question here regarding from Shelly Avila.
Shelly Avila.
Would I be able to get a rhinoplasty and breast augmentation at the same time?
Would I be able to get a rhino and breast aug at the same time? So the answer is, can I do multiple procedures? We've answered this question on multiple occasions. The answer is yes. You can do a rhinoplasty, your ear pinning, and a labioplasty. You can do your rhinoplasty, a brow lift, and a tummy tuck. You can do whatever the hell you want so long as a few criteria are met. Number one, your surgeon isn't rushing to do the procedures. So I know my limit. I know how many procedures can I do safely. What does safely mean? It means that I feel like I'm not in a rush. Since I'm a one-man band, Dr. Rady Rahban, have no one help me do anything. So it's all predicated on me. When your surgeon wants to do a lot of procedures, he or she is going to have other people help them. Other people help them. Who the hell are they? Oh, there's a PA, a nurse practitioner, a tech, another doctor, or whoever. So they tag team the procedures. Someone's closing the tummy tuck while someone else is starting X, Y, and Z. So you want to identify, are you doing all the procedures? Is there anybody else there besides you? Are you closing everything besides yourself? And then how long of a surgery can you do, and pay attention? So that's number one criteria. And the other criteria is you just want to make sure that things don't conflict. So for example, I don't do brachioplasties, that's arm lifts, with thigh lifts. Why? Because you got to get out of bed somehow. So you either got to use your arms or you got to use your legs. And so I don't like to do those procedures together because when you try to get out, you're going to push on your arms or your legs and ruin one of them. Conversely, you also don't want to do procedures that cause issues to each other. So I don't do, for example, body lift where I place you on your face and then do a rhinoplasty, right? Because at the time of the surgery, I'm going to crush the thing that I did. So the answer is, can I do nose and breast? The answer is yes. Can I do multiple surgeries? Yes. What are the restrictions? Each surgeon needs to tell you what he or she feels comfortable with. But by and large, you can do multiple things without much concern.
Okay, coming from there, Marissa Cool.
Yeah.
Is having brachioplasty and tummy tuck done together reasonable?
So brachioplasty and tummy tuck reasonable? And the answer is yes. I think it's reasonable. I say to myself, Dr. Rady Rahban, can you, meaning are you able to, are you tired, or is it long? Can you do her arms and her tummy tuck? And the answer is yes. I can do your tummy tuck and then do your arms in a safe amount of time and do it with high quality the way I do it, sewing everything together, yes. But if you had said, can I do your brachioplasty with your thighs? I would say no.
Okay. And Salud Signs.
Okay.
Says, why do most docs ask their patients to wear special fajas or girdles, but you don't? Is there a difference?
I do. It depends. It's a very broad question, and I don't know exactly what the question's regarding, but I can just tell you, the only garment that I ever make anybody wear is after a tummy tuck. I have a binder that I selected. It's an amazing binder, and I make you wear that binder morning, noon, and night religiously, with the exception of showers, for 6 weeks. And the reason I do that is because I've repaired your muscles, put a lot of tension on your abdominal wall, and I want, like a broken arm that's casted, I want to cast your repair for 6 weeks so your body can make a nice solid scar and hold the muscles together. Other than that, I don't like you wearing all these other garments, because what do garments do? They tend to, or fajas and things, first of all, they camouflage the result. So if you're relying on the faja after the surgery, well then what was the point of the surgery? Just wear the faja. Faja being some kind of Spanx or binder or whatever. Furthermore, in general, like patients who come at 6 weeks are like, oh my God, I love my tummy tuck, Dr. Rahban. It's amazing. Can I continue wearing this binder? And the answer is no, you can't wear the binder. You got to get rid of the binder. You got to burn it. You got to have a bonfire. You need to start activating your muscles. So if you wear a splint on your wrist starts to get weak. You're weakening your wrist by wearing a splint. When you wear a binder or a faja for long periods of time, you're not using your muscles because you're splinting them. And then you start getting weak. So at 6 weeks, you got to burn the damn thing.
Well, that's about it. There's all the pertinent questions. We have more questions, but we got to save some for our next.
All right. Well, that's good. That was a pretty. Hey, you guys are doing a great job. I love your questions. Some of them don't make it because, well, they're not very good. And some of them are extraordinary and great and very fascinating. So
we save them for the next episode.
We save them for the next Q&A of next month's episodes. At any rate, we love you guys writing in. Thank you so much for listening to our show. I always make the same ploy at the end, which is the show exists because you listen. The show doesn't exist in a vacuum. So number one, thank you for listening. Number two, download and subscribe to the episodes because that empowers us to keep going. Number three, share it with people that you think are interested in plastic surgery. You never know who's going to go do what. And by sharing our podcast, hopefully you empower them to make good decisions. And last but not least, go write something nice. Go on to our, review area. If you like the show, jot something lovely. It makes us happy. That's it. At any rate, that wraps up yet another episode of Plastic Surgery Uncensored. As always, I'm your host, and we will see you next week. Thanks for joining me, Maria. Bye-bye.